Hello everyone, I'm Balaji Narayanan from Onyx Health and I'm here to talk about the electronic prior authorization. So before we get into the actual topic, I would like to introduce Onyx and as well as myself. Onyx is a SaaS solution provider with multiple products to its repertoire and have implemented with multiple clients across the US payer industry. And I am Balaji Narayanan. I am a VP of Engineering and Product Development with Onyx, and I lead the initiatives of product development. And electronic prior authorization is also a product that I lead with. So before we go ahead and explain what an electronic prior authorization is, I would like to explain what a prior authorization process in the industry is. So prior authorization, as the name suggests, is a pre-approval process. Basically, when a provider wants to initiate a treatment plan for a patient or a pharmacist wants to approve a drug for a patient, they would have to seek the approval from the health plans to make sure that the patient is covered for this particular treatment or for a particular drug. So the payer determines once the provider initiates a request to the payer and the payer determines the validity of the request and make sure that the patient involved has the active coverage, has the active eligibility, and either denies and approves the request for the prior authorization back to the provider. Typically, a prior authorization process takes about 10 days, and that's a very conservative timeline. It involves multiple stakeholders, right from the initiated process from the provider up until the approval process from the payer side. And prior authorization also involves multiple back and forth communication between the provider and the payer. There could be multiple inquiries asking for more details, more documentation, more treatment plans that was already performed on the patient. So there is always a possibility of a prior authorizations to get extended beyond the timeline. And there is always a possibility looking for more documentations to be submitted as a part of the request.